Have you ever been told not to raise your hands above your head during pregnancy, or your baby's umbilical cord might wrap around their neck? Yeah, I have had that too, but here's the truth. That's not just how biology works. Welcome to Motherhood Unfiltered podcast. I am Isitu. I do the research so you get the facts. Today we're breaking down some of the most common and sometimes dangerous pregnancy myths that have been passed down for generations. But before we start, let me just say this. I am not a medical doctor, neither am I a medical professional in any capacity. This podcast is for educational and informational purposes only. Always consult your healthcare provider for medical advice, diagnosis, or treatment that's right for you and for your pregnancy. With that said, let's dive in. One of the most common pregnancy warnings I have had is don't raise your hands above your head. The baby's umbilical cord could wrap around their neck. This belief exists in many cultures. I mean, from West Africa to South Asia to parts of Latin America. It's usually shared by elders, sometimes with very good intentions, because everybody wants to protect the baby. But here is the science. Umbilical cord accidents, where the cord wraps around the baby's neck, happen in about 10 to 15% of pregnancies, according to the American College of Obstetricians and Gynecologists. These are usually caused by the baby's own movements in the womb, the length of the cord, or sometimes the amount of amniotic fluid. A mother's arm position definitely has nothing, absolutely no effect on this process. Think about it. The womb is a closed environment. Your baby is floating in amniotic fluid and the cord is attached to the placenta. So, whether you are reaching for something on a shelf or you're just stretching in bed, there is no direct way for your movements to manipulate the cord inside the uterus. So the next time somebody wants you about this, they tell you that do not raise your hands above your head, you can just gently reassure them and tell them that that's not how it works, but the doctors had also told you that it's totally fine and safe. So another myth that I wanted to cover in this episode is that you should not eat spicy food, that it might make you go into labor. This is one that I have had, like, it's everywhere. You will even hear people recommend spicy food as a natural induction method, whether you are close to your due date or you're just inducing your pregnancy. But what does the science say? Spicy food does not trigger contractions or induce labor. What it does do is it irritates your digestive system, which can sometimes cause diarrhea or stomach cramps. And because your uterus sits close to your intestines, those cramps may be mistaken for contractions. But clinical studies, including those reviewed by the Mayo Clinic, have found no evidence linking spicy foods to the onset of labor. So, that said, pregnancy hormones already slow down your digestion, which is why heartburn and indigestion are also common. But spicy food can make that worse. So if you notice the jalapenos giving you unbearable acid reflux, maybe hold off, but not because it's going to make your baby come early. Another myth we have all had is that if you're carrying high, it's a boy, but if you're carrying low, it's a girl, and if you're carrying low, it's a boy. It's just fun guessing games, but let's be clear. This has no scientific basis whatsoever. Here's what actually determines how you carry. One is your abdominal muscle tone. First time moms often carry higher because their muscles are tighter. Moms who have had multiple pregnancies may carry lower because the muscles have stretched. Number two is the baby's position. A baby sitting head down in the pelvis will actually make your bump look lower, while a baby lying sideways might make the bump look wider. So, three is also that your body shape and your height. Tall women may hide their bumps differently than shorter women. A 2015 review by the Cleveland Clinic confirms that there is no medical evidence that carrying shape or the carrying shape or the bump height predicts gender. So the only reliable method of finding out your baby's sex are medical. That is by doing ultrasound, genetic blood test, or waiting until delivery day. Another myth is that you're eating for two. This one sounds lovely. I know it does, but pregnancy is your license to eat whatever you want in double portions. But unfortunately, that's not accurate. Here is the truth. In the first trimester, you don't need extra calories at all, nada. In the second trimester, you actually need about 340 extra calories per day. Whilst in the third trimester, that goes up to around 450 extra calories per day, according to the US Center for Disease Control and Prevention. To put this into perspective, let's say 300 to 450 calories is roughly a bowl of oatmeal, a sandwich, or a smoothie, not double meals. If you're overeating during pregnancy, this can actually increase the risk of gestational diabetes, preeclampsia, larger babies, which can actually complicate your delivery. So, on the flip side, undereating can actually affect your baby's growth and your own energy levels. So, the goal here is balance. You need to be able to make a balance and also focus on nutrients rich foods. For instance, whole grains, protein, fruits, vegetables, and healthy fats, rather than doubling your food intake. So instead of eating for two, think of it as nourishing for two. The next myth, which is that exercise is dangerous, is one of my favorite ones. But maybe because I love to exercise and I did so all through my pregnancy. For decades, women were told to rest as much as possible during pregnancy. Some cultures even encourage pregnant women to stop all physical activity. But modern research paints a very different picture. The American College of Obstetricians and Gynecologists recommend at least 150 minutes of moderate exercise per week for most pregnant women. So that is about roughly 30 minutes a day, or let's say 5 times a week. The benefits includes a lot and they're very numerous. That is reduced risk of gestational diabetes, which is a very, very common cause in pregnancies, better mood and lower anxiety, improve sleep. It also helps with the back pain that you feel a lot during pregnancy. You also gain better endurance for labor and delivery. But some of the safe exercises you should include when you want to exercise will be walking, swimming, prenatal yoga, also stationary cycling. You know those stationary cyclings you have at the gym, you could also use that rather than using the traditional cycling method. The key here is to just avoid high risk activities like contact sports, scuba diving, or anything that risks you falling. So if you have complications like preeclampsia, is it previa? Yeah, or risks of preterm labor, your doctor may advise restrictions, but for most pregnancies, moderate exercise is not just safe, it's recommended. So, no, you do not need to sit still for 9 months. In fact, movement can make pregnancy healthier and more enjoyable. Here is what you want to remember from today's episode. Many pregnancy myths actually come from love and protection, but they are not always accurate. That's one thing you always have to remember. Always also ask yourself, like, where did this belief come from? You want to also ask, does research back it? And lean on healthcare providers, really, not the internet or even family gossip when you need clarity. So the next time somebody tells you not to eat, let's say, pineapple, or they insist that you can guess your baby's gender based on how you're carrying, just smile, thank them for caring, and then trust the science. Just trust the science. That's it for today's episode of Motherhood Unfiltered. I do hope you enjoyed this episode, but please do remember that this podcast for information is for informational purposes only, and it's not a substitute for medical advice. So if you have any questions about your pregnancy, please consult your doctor or midwife or gynecologist. So if you've learned something new from this episode, please do share it with another woman who needs to hear it. Do not forget to subscribe so you do not miss next week's episode, where I will be talking about what no one tells you about labor and delivery. Just some of the things that you need to know. I'll see you then.